On Instagram Live. This is Dr. Nushin Darvish coming to you from Holistic Naturopathic Medical Center out here in Bellevue, Washington. I hope everybody's doing well. I have a very, very special guest with me today. It's one of my patients who will be joining me to hopefully discuss breast implant illness. So I'm trying to bring her on live on Instagram. Let's see if she comes on. This is Jenna. Hi, Jenna. I think you're almost there. Yes, hello, Jenna. How are you?
Hi, thank you.
Yes, I'm so excited to have you with me today because we are talking about breast implant illness.
Thank you.
It's such an important topic. It is, I think, vital for every woman to hear about it, especially women who are considering having implants, those who have implants, those who are chronically ill and have implants. I think this is really, really important conversation. So welcome to Holistic.
Thank you.
I'm glad to have you.
It's good to be here.
Yeah. So I'm going to get to your story in just a minute, but I just wanted to share with people about the breast implant history, and that since the 1960s, we've known about breast implants and their side effects and their issues with them. But it was so interesting that there were no studies done on these implants, whether it was saline or silicone. FDA never required any kind of studies to be done before they approved them. They were kind of grandfathered in once the FDA in the 1970s, 1980s took over regulating implants. So women were getting implants without any safety studies done on these. And it's actually kind of scary because it took them nearly 30 years before they started requiring proper testing. And to this day, they still don't have proper testing done on the safety of implants for patients, for women. And yet we hear reports. There's a doctor, a rheumatologist, Dr. Brower, out of New Jersey. He's a rheumatology doctor, which basically means that he is a doctor who looks at autoimmune diseases and joint pain and chronic fatigue and lupus and rheumatoid arthritis, all of these autoimmune diseases. And he has kept track of this since the late 1990s and looked at females who were coming down with all these chronic symptoms and related them, or associated these symptoms to the implants that many of these women were had in them, you know. So it's really scary as to what we have done with our females in some sense, and how chronically some women are, and they don't know that they're sick. So I wanted to share with the rest of the audience, the Instagram and Facebook people, your story, because I think it's a story of empowerment. It's a story of transformation, and it's the story of inspiration. So you have always inspired me, Jenna, and I'm so excited to have you here to help inspire more people. So why don't you start off and share with us your story?
Thank you. It's so good to be here. So I had two babies, and I breastfed both my babies, and I loved breastfeeding them, and I just didn't like what happened to my breasts afterwards. And I had a lot of postpartum depression with my last one. And I thought the only way to feel better was to have my breasts improved. So I got breast implants when my youngest was 18 months old and in my early 30s. And I hated them.
Why? Why did you hate them?
I felt like they were square. When I first got them in, for the first year, I didn't like myself without clothes on. I only liked my clothes. It was really weird. So I had them taken out after 11 years, and my mom said, just to remind you, you hated these when you first got them, because I had forgotten that part. But yeah, I completely forgot about that. So, but I just felt really awful after a few years, and I was trying everything I could to feel better. And I was diagnosed about 7 years after getting them with celiac disease. And I never saw the correlation between my implants and my health. And I, about at 10 years, I got in a car accident in Seattle in the rain, and my car was totaled, and I had the airbags deployed and hit the left side of my body. And from that day on, I had really bad pain in my left breast. And I had that pain until I got them removed a year and a half later. And so before that, I really didn't have a lot of pain in my breasts, but during that time I did. And so that, I think that was, got the ball rolling for me, thinking that these are not helping. My body is fighting these. I actually had a massage therapist ask me, just ask your body, are these working for you still? And I started crying. I said, no, I know they're not working for me. I need to remove them. And I found a Facebook group called Healing Breast Implant Illness with Nicole. Nicole Deruda is the founder of that. And after getting on that Facebook group, I took my implants out, or we call it explanted. I explanted 9 weeks later. So as soon as I got on the Facebook group, I knew. I said, oh my goodness, that is what is wrong. And no one believed me. My doctors at the time didn't believe me. And my therapist didn't believe me. My husband thought I was crazy. And it was really great because I found you and your clinic 6 months after I explanted. And so it was so nice for someone to tell me, yes, your implants were hurting you and I can help you.
So I just want to be clear. So before the car accident, you were having symptoms, just not localized to the breast.
Right. Yes. So one of my worst symptoms was my left arm. It was always my left side. And so when the car accident happened and the left breast started hurting, it became localized. Because before that, it was just systematic, right? It was just systemic. It was like very weird things that ringing in ears. My left side was completely numb, and every day I woke up, my arm was tingling. And I kept thinking, am I having a heart attack? Why is my left arm numb? So before that, it was not localized.
And what about brain fog and fatigue?
Oh, yes. Yes. And my husband just said, you're just getting older. This is just part of us getting older. And I was like, no, this is not getting older.
Yeah. And what about dizziness?
Oh, so what I did as soon as I found the Facebook group is that I wrote a list of all my symptoms. Because I went to a plastic surgeon and she said, oh, I see you printed out their list, because she was very against breast implant illness and was belittling me, saying, I see their list, or you printed out their list. And I said, no, this is my list. And so I went down and I wrote down everything that I was feeling and what I thought was connected to breast implant illness, and then things that I thought might be related. And you forget all these things, because once you start healing, you forget. And so when I was looking, I thought, I wrote down dizziness 10 to 15 times a day. I don't remember that, but I'm so glad I wrote everything down.
Yeah, wow. So you had saline implants, but it had the silicone shell. And, most of the preconception is that you can only react to a silicone implant, and it's usually a leak, and it's because it'll be toxic to your system. But that's not true. That's not true. It doesn't matter whether you have saline or silicone. You still can have dramatic symptoms, right?
Mhm.
Anything
Yes.
from brain fog to joint pain to just fatigued, muscle aches, stomach issues, digestive issues. And the reason for that, by the way, when you had them removed, did you have the surgeon take a picture of before and after, or the two implants once they were out? Did you have a picture?
Yes.
And what did you find?
They looked brand new.
Okay.
So people think they have to be leaking to hurt you, and they don't. They don't have to be, like you said, saline silicone. There's also gel. The manufacturers are trying their best to make things that are safest, but they're just more chemicals. And so even the gel ones have a silicone outside. The outside of the implant is silicone. So yes.
Yes. And these implants, like I said earlier, they really haven't been studied properly. And in the 1990s, when they started doing some studies, these studies were very poorly designed, or just not very good studies. So, for instance, they had follow-ups after the implants were put in for 2 months or 3 months in some of these studies, and they were mostly looking at them in the rats versus really proper human clinical studies. And to this day, they still don't have proper clinical studies that show the safety that are long-term, right? Long-term studies. Most women don't know, but implants should be switched out 10 years. I mean, that's their basic lifespan, right? 10 years. But females typically start feeling symptoms 2.5, 3 years after the implants are put in, and they don't quite connect the two because it's so far away from the time of the implant, right? It's a foreign substance to the body. Ultimately, it's a foreign substance.
Some women have symptoms from the day of operation, and they don't understand that they are connected to their implants.
Yes. And then when they get them removed, there was a study that looked at over 300 women, and they found that 89% of them, when they had the implants removed, significantly improved in their symptoms. So it's a pretty strong tax on the system. And really, one of the main issues with breast implants is that it activates the immune system. Because it's a foreign substance in the body, the immune system becomes activated and tries to kind of conceal this out. It kind of builds what we call a biofilm around it. And, they say from surgeons saying that these are capsular contractures, which is basically the thickening of the muscle, the ligaments, the tendons around that capsule. But the problem is more than that, because oftentimes silicone is a form of metal. It's silica. It's a form of metal. And so it attracts infections, and mold being a very common one, right? And so when that mold enters the system, then the immune system is even more chronically reactive, and all of these toxins that the body's trying to produce as a result of the inflammation around that implant to kind of seal it off slowly starts seeping into the lymphatic system, right? I've even seen patients, it's really amazing, but I've seen patients, when we've come to do blood draws, we see little, it's almost like a little thread of silicone coming into their needle, into their syringe. You can actually see it from their blood. So we know, I mean, I physically see it, that these particles get released and the body is trying to clean it up. And that's when the immune system reacts. And that's when you start feeling some of these funny symptoms.
Well, yeah. And you were saying, like, when you're talking about scar tissue capsule right now, you were talking about how doctors recommend to get them out, 8 to 10 years. The problem, a lot of women don't have any problems with their first set, but they get their first set out, put their second set in, and start having problems. It's because the scar tissue capsule has been opened, released all those toxins that haven't seeped out yet, and the explant surgeons aren't removing the capsule. So that scar tissue capsule that you were talking about that has all those toxins that is trying to keep it in the body, when surgeons open that up and just take it in and put another implant in, they're releasing all of those into your body. And that's why so many women have problems with just their second set. So a lot of women, they just don't know. They're so confused. They had no problems with their first set, but their second set was just opened the floodgates.
So I'm going to ask you, what did you do to help yourself heal? What was the series of therapies or events you went through? Because when you do remove the implants, that's only the start of the issue, right? The start of the healing. You have to remove the source. I always say, when you walk into a room and there's a room that's flooded, you've got to stop the leak first, right, in the faucet. And then also you've got to clean up the floor and repair it, and then give it a polish. So that's what happens with these implants, right? Because there's a leaky faucet that are releasing these toxins. And I've seen some really incredible toxic, pussy, yucky looking implants after they've been removed, the right and the left being completely different.
Yes.
And like green pus coming through. It's disgusting. And you think, oh my gosh, that was in my body, or it was in this patient's body. And what havoc has it done to the system? Because all of that leakiness, all of that gunk is now in the lymphatic system, in the blood, and starting to settle in the rest of your body. Sometimes it becomes a trigger to the immune system reacting in an autoimmune way. And that's why there is an increased risk for autoimmune diseases related to implants. So, Jenna, what did you start doing after you had them improved or removed, I should say?
I agree 100%. I thought getting them out was going to be the final step on my health journey. And it was kind of upsetting when I found out that I took them out and now I have to do a lot more. So I feel like so many of women's post-explant journeys are so personalized, right? And so that's why I liked when I met you in your clinic 6 months after I explanted, it was a lot of different things you did for me, as opposed to my friend that saw you for breast implant illness for the same exact thing. And so I started with just supplements for drainage, and I did some IVs. I did some hyperbaric chamber. I will say that therapy has helped a lot, because there are valid reasons why women get breast implants. This is not just something you think of and get the next day. There are women that are getting these for valid reasons. And so when you get them removed, a lot of it can be mental, right? So I think therapy was very important for me too. But with you, it was a lot of figuring out what was next. Okay, we got the implants out. Now let's figure out with Dr. Darvish how we're going to do some drainage, how we're going to build up my immune system, how we're going to get me back to healthy once I took the toxins out. And I, like you were talking about how you had seen disgusting things on the inside of the implants, and mine came out looking brand new on, just from looking at them. But when someone says, oh, there's saline, like a bag of saline, I always tell them, the women, think of like an aquarium, a dirty, disgusting fish aquarium, not a clean bag of saline. Because that's what your body is reacting to that.
Yes. And it activates a lot of different things in the body. And you mentioned the emotions. The physical scar leaves an emotional scar, right?
Yes. I've done a lot of neural therapy.
Yes. So what is neural therapy? Tell me, because just for the sake of our audience, I want to enlighten them about what we do here. So neural therapy, what was your experience with neural therapy? What is it?
So I had 2 C-sections, And I've also had a laparoscopy for endometriosis. And then I had my explant scars. And so when I started seeing Dr. Darvish and the doctors in her clinic, they started working on my scars with neural therapy. So I tell people neural therapy is procaine that goes into your scars. I don't know, this is probably not even the right thing, but goes into your scars. It's little needle pokes that go into your scars, and it helps your scars heal. So I've had it done, and my kids have had their scars had those treated too. Yeah.
Well, yes. So neural therapy breaks down the scar, but the way I see it also is that it gives your system a reboot. It's rebooting the nervous system. It's a German technique, and it's just injections along that scar to get the lymphatic system moving, the nerves growing back in there, the circulation moving, so that it can clear out the toxins that have been building and bring in the healthy blood to get your body to heal. But oftentimes those scars have left an emotional scar, which is really also a block, creating a block in the healing process. So not only do we have to clear the physical scar, but also the emotional scar. And then as we work through that, it's the underneath that, like you said, why did you get it in the first place? Let's look at that and let's heal that, because woman, it's such a in-depth or deep-seated issue that we've been facing for centuries, right? That we are inferior than men, that we are an object, right? And unfortunately, we have bought into that mindset as well, right? We forget that we're really, the beauty comes from inside, and we are really beautiful souls encased in this physical body. And of course, it's really important to take care of this physical body. But then I think sometimes we get thrown off, especially when we have babies, that our bodies don't look the same. They don't feel the same as when you were younger or before pregnancies and before babies. And you just want that old body back, that young body back, I should say, right?
Yeah.
And it takes a lot to recognize and accept that we are perfect the way we are, right? And we are just perfect the way we are. And to heal that, because when you're doing that, you're not just healing you're healing generations back, women generations back, and the trauma that women have faced and dealt with for centuries, and the scars that have been left behind. So it is a really huge healing endeavor that we embark on when we are looking and working with these kind of issues. It's actually really awesome. So this is why you're so inspirational, because you were willing to just take them out and just say no. And that in itself is a big deal.
It was a huge deal. Yes.
It's a huge deal. It's a big deal. And just say, I'm not going to do that. And now it's like my body now looks different again. So what do I do now? And on top of that, I don't feel good. What do I do now? Right. And so the process that you go through is really complex. It's not just a simple, I got the surgery, it's done with. Let's move on.
Everyone thinks it is. Like a lot of women think that that's like that. And it's not. I had never been so excited to see my natural breasts before. And so when I got them out, I was so excited. I'm like, oh, yay, I have my own little boobs back. And I looked at my before pictures from 11 years earlier, and they looked exactly the same.
That's awesome.
And I thought, how funny that it took me 11 years and all this horrible feeling of having the breast implants and all these things I went through to appreciate my natural breasts,
Yeah. But you're stronger and healthier physically, mentally, and spiritually, emotionally in so many ways now as a result.
Yes. Well, right? And I have a couple girlfriends that have removed theirs from me sharing my story. And that makes me really happy, because
that's awesome.
I've said, do you think that your thyroid issues could be connected to your implants, or do you think, and they said, yes, I do. And so it's great to be able to share my thoughts with that.
Yes. In fact, I was going to have one of my other patients join in today, and I thought it would be too confusing to go back and forth technologically. But she suffered from thyroid cancer. And when she came in here, I said, your implant, the left one, is a problem. No, it's not leaking. The surgeon says it's just all perfect. I said, it's a problem. And this took her probably at least 6 months, 8 months to hear me tell her the left, I think it was actually the right side, is not healthy, it's not good, it's moldy, there's something going on, your immune system is having a problem. And finally, she said, okay, I'm going to go have them removed. And at that point, she went into a crisis mode of, I got to get it done now before my thyroid goes, thyroid surgery. And so she finally went down to Costa Rica to one of the doctors down there, and had it removed within a couple of weeks after that. And when the doctor took it out, before he took it out, he also thought that they were fine. She was just crazy. When he took them out, and I've posted that on one of the videos that we created for the breast implant illness on Holistique. When he took them out, the right one, the one I was saying that's moldy, was all pussy, green pus coming out, and the encasing was thick and just disgusting. And they just couldn't believe that this was in her. Now, the actual implant looked perfect.
Isn't that crazy? Yeah.
But there was nothing going on with the actual implant. It was what the immune system was creating around that implant that was so incredibly toxic and making her sick. And since then, once she got it out and she's been doing detox, and she's really, her nervous system is calmer. She's emotionally a lot better. She's just, energy is better. She's not as stressed out and anxious. And stomach symptoms are better. A lot of things are better. Now, you also mentioned you were diagnosed with celiac a few years after the implant.
Yes.
So that's also very interesting, because celiac is really kind of like an autoimmune disease as well. And with autoimmunity, we look to see what is the trigger. Something triggers the immune system to go wake up and react to itself. And most likely it was the toxic reaction to the implants. So how's your digestion now?
It's better. It's a lot better. Of course, I'm gluten-free. I'm always 100% gluten-free because of my celiac diagnosis, but I feel a lot better.
Yes. So, breast implants illness and healing is very complex. We have to look at the genetics of where your detoxification factors are doing, what your nutrition deficiencies are. We have to look at the toxic heavy metal load in your system. We have to look at liver function. We've got to look at the viruses, the molds, the bacteria that surround these capsules and the implants. And so it's a process of, like what you went through, to do some IV vitamins therapy, some maybe ozone therapy to clean the system, to get the immune system to wake up, to correct the immune function. And I don't think you needed this, but with some women, I need to give them peptide therapy, which is chains of amino acid that correct the signaling of the immune system, so that instead of constantly reacting to itself, it learns that, no, there's nothing to react to. This is part of my own body. I'm fine.
Is that with a supplement?
It's either a self-injection. Very rarely it's an oral capsule.
Okay.
It can be self-injection, or sometimes it's an IV form, intravenous form. Yeah.
Very cool.
And then you did a lot of foot baths too.
I did a lot of foot baths when I was doing the IVs, and I loved it. It was so great to feel that. Yeah, I like the IV. Yeah.
What happened? What did you feel with the foot baths?
Oh, I just love that. I think they're relaxing, and when it's really great to, this sounds gross, but to see what comes out when you're sitting in the foot bath. And I know a lot of people say they're controversial and they don't work, but you can see what they're doing.
Well, ionic foot baths actually are based on the science of iontophoresis, which basically means that if you have electrically charged positive water, that the negative charge ions in your body will be pulled towards that electrical charge. So it's just like a magnet, and those toxins will release through the pores of the feet. And then if you have a negatively charged ionic water, then it's going to pull out the positive charged toxins. And so that's what you're seeing. You're seeing the reaction of these different substances that are electrically charged against the charged water. That's why.
That's so cool.
Yeah, and I know when I get them, I feel like there is a levelness. It's a really clean feeling inside. I get. Do you feel that too?
Yeah. Well, it just feels lighter, I think.
Yeah, lighter all throughout.
Yeah.
What else did you get? Hyperbaric oxygen. You said hyperbaric oxygen. Tell me what your experience was with that.
Oh, I love hyperbaric. When I do that, I feel like my brain fog is better and clearer with that. I just lay there and read or take a nap. And so I always feel like it's just a little like, oh, like relaxing, but like also makes me feel better, clearer.
Yes, and that's because we're forcing oxygen into your cells. So when cells become toxic, they lose their capacity to use oxygen, right? And so when we give back oxygen to your cells, it's kind of like a kickstart wake-up call. Oh, there's oxygen around, I can start using it. And it starts learning how to use oxygen and get rid of the toxins that have been harbored inside the cell. So we're not just treating the outside of the cell, but also inside the cell, because some of the immune response that happens with this. Now, you know, this breast implant illness is really complex and we don't know enough.
Right. It is. And you were saying about you were talking about the plastic surgeon in Costa Rica. I don't know if that was Dr. Ursula or not, but he's very well known in our Facebook group for breast implant illness because he believes women and he takes them out properly with a capsule. I will tell you that I went and had 3 different consultations with plastic surgeons in Seattle, and all 3 of them said, your implants and breasts look amazing. I don't think you should do anything with them. And I said, well, they're 11 years old and they're killing me. And they all said, no, they look great. I wouldn't change a thing. So even though the FDA and the manufacturers and the plastic surgeons are saying these are only good for 8 to 10 years or 12 to 15 years, depending on whatever one you got, the plastic surgeons don't want to take them out.
Yes. Well, yes.
Or
by the way, there is one of the companies, Allergan, recalled their breast implants about a year ago. And I don't think too many women who have those implants know about that. I actually currently have a patient who we've been preparing to go in for her surgery. She has the Allergan and she is really sick, very, very sick. She's a mother of 2 and having really hard time being a mother. But I know as soon as she gets those out, she's going to feel much better. So maybe we'll bring her back on and have her share her stories.
That'd be awesome. So a lot of the, I don't know if the Allergan ones that were recalled were the textured.
Yes.
But the textured ones are the ones that are now linked with BRCA, which is a new kind of breast cancer only found in breast implants.
Yes.
Which is so crazy to me that the FDA, I'm glad that the Allergan ones were recalled.
Yes. But that can also cause other cancers that we're not linking it enough because we haven't really spent much time studying these things, the long-term effects of these implants. So it is a big problem. It's a big, big problem. So I just hope that women get a chance to really look into breast implants and the consequences of them. That the symptoms that you're talking about are not uncommon. They're extremely common. I mean, you said 2 of your girlfriends had similar symptoms and had them removed and are feeling better, right? And so it's much more common. It's just that the doctors are not making the link, the patients are not making the link, and they just think that, oh, these can't have anything to do with what I'm feeling like. But then when you go to a place where they're actually, we're looking at you as a whole body, your whole being, connecting the dots, looking at the root cause, and kind of layer by layer removing the causes of some of the illnesses or symptoms that you may have. As we go through these layers and we come down to that, oh, it's the right implant or it's the left implant. Oh yeah, they feel fine, but no, they're emitting something that's making you sick. You know, so that is really, really important to for women to look into, to get on your Facebook. Tell me about your Facebook groups.
So I joined a Facebook group 4.5 years ago, and it's called Breast Implant Illness Healing by Nicole. And it used to have a different name, so that's the name right now. And it was so helpful. And I explanted 9 weeks later, and it used to have a couple thousand women when I joined, and now it has over 120,000 women.
Wow.
And it's just a support group. They're talking about their symptoms. They're talking about explant. They're also talking about surgeons. And so we also have one in the Pacific Northwest Breast Implant Illness and Healing. And that talks, it's more local ladies that talk about specific surgeons. And we actually have met for lunch, and we send each other post-surgical bras, and we are here to help each other. So
that's awesome.
It's super great that we have that support. And like I said, when I went to you for the first time and you said, yes, your implants were making you sick, that validation and hearing that from you was so important, because a lot of women don't get that from their doctors.
Yes. Yes. Well, Jenna, thank you so much for joining me. I hope this has been so helpful for so many women out there, at least for them to share it with their friends and daughters and mothers and grandparents or grandmothers, and for men to become aware of some of the symptoms that their wives may be going through and chronically complaining, and yet they don't know why, you know. So this has been really uplifting and powerful. Thank you so much for willing to share your story with the rest of the world.
Thank you.
You are truly an inspiration to all of us, women and the world. So thank you again for joining us. Please, everyone out there, listen to what Jenna's got to say. And educate yourself, educate your friends and family. And then anything that we shared here, of course, is just informational purposes. It's not really meant to treat or diagnose any condition. So you really need to seek out a provider here at Holistique or elsewhere who will look at you as a whole person and really look for the root cause of your symptoms and illness, and do a systematic, methodological process of helping you heal through breast implant illness. Next week, we will be moving into November and talking a little bit about men's health. We're going to be talking a little bit about diabetes and Alzheimer's for the month of November. So please join us on these lives at 12:15 next Thursday. Thank you again, Jenna.
Thank you.
I will see you back in the office soon.
Okay, sounds good.
Bye.
Bye.